Hello, I'm
Hello, I'm
Sonia
Sonia
Manuel,
Manuel,
and this
and
is our
this is our
COVID-19
COVID-19
research
research
presentation.
presentation.
I will
I will
start with
start with
introducing the
introducing the
definition
definition
of a
of a
pandemic.
pandemic.
The
The
term
term
pandemic is when
pandemic is
there
when
is
there
a
is a
severe or fatal disease that is contagious from person to person and extends over a large geographic area. Additionally,
Additionally,
most people use the
use
word
the word
pandemic
pandemic
as
as
disease
disease
movement or
movement or
spread
spread
via a
via a
transmission
transmission
that is
that is
traced from
traced from
place to
place to
place,
place,
which is what
which is
has
what
been
has
done
been
for
done for
centuries.
centuries.
It is
It is
essential to
essential to
consider
consider
diseases
diseases
commonly
commonly
known as
known
a
as a
pandemic
pandemic
previous to
previous
the
to the
coronavirus,
coronavirus,
such
such
as
as
AIDS, the
AIDS, the
plague,
plague,
HIV,
HIV,
and West
and
Nile
West Nile
disease.
disease.
And of
And
course,
of
there are
course, there
many
are many
others, but
others,
those
but
were
those are
just a few
just a few
examples.
examples.
In
In
trying to
trying to
understand the
understand the
similarities
similarities
and
and
differences
differences
among
among
each,
each,
as
as
each are
each are
different, but
different,
all
but
are
all are
considered an
considered an
infectious
infectious
disease
disease
that are
that are
known to
known
be a
to be a
pandemic
pandemic
according to
according
the
to the
public
public
health
health
officials.
officials.
Now I'm
Now
going
I'm
to
going to
talk a
talk
little
a
bit
little bit
about what
about what
COVID-19
COVID-19
is
is
and
and
COVID-19 as
COVID-19
a
as a
pandemic.
pandemic.
COVID-19 is a
COVID-19 is a
vast,
vast,
worldwide
worldwide
spreading
spreading
virus
virus
leading to
leading to
today's
today's
pandemic.
pandemic.
The
The
spread is
spread
from
is from
person to
person to
person when in
person when in
close,
close,
confined
confined
areas with
areas with
other
other
people
people
affected with
affected with
COVID-19.
COVID-19.
The
The
person to
person to
person
person
spread
spread
is like
is like
other
other
respiratory
respiratory
viruses,
viruses,
which
which
happens
happens
from
from
respiratory
respiratory
droplets
droplets
produced
produced
from an
from an
infected
infected
person's
person's
cough,
cough,
sneeze,
sneeze,
or when
or when
speaking.
speaking.
The
The
contagious
contagious
droplets can
droplets
go
can go
into
into
mouths,
mouths,
nose,
nose,
or
or
eyes of
eyes of
people who are
people who are
nearby an
nearby an
affected
affected
person.
person.
And there is
And there
even
is
a
even a
chance that
chance
someone
that
can
someone can inhale
it
it
into their
into their
lungs,
lungs,
causing
causing
respiratory
respiratory
issues.
issues.
With this
With this
virus,
virus,
people
people
can
can
experience
experience
typical
typical
flu-like
flu-like
symptoms,
symptoms,
but
but
others
others
will
will
experience no
experience no
symptoms
symptoms
at
at
all
all
and
and
still
still
carry the
carry the
virus and
virus and
able to
able to
spread it
spread
to
it to
others
others
around
around
them.
them.
This is
This is
called
called
asymptomatic.
asymptomatic.
COVID-19
COVID-19
relates to the
relates to the
term
term
pandemic
pandemic
as
as
defined
defined
in
in
the
the
previous
previous
slides.
slides.
COVID-19 fits
COVID-19
the
fits the
criteria
criteria
for
for
the
the
label
label
pandemic
pandemic
because of the
because of the
high
high
amount
amount
of
of
persons
persons
affected by
affected
the
by the
coronavirus and
coronavirus
how it
and how it
extends
extends
over a
over a
very
very
large
large
geographic area. The
The
coronavirus is
coronavirus is
affecting the
affecting the
world in
world
many
in many different
ways,
ways,
such
such
as
as
states,
states,
towns, and
towns, and
cities
cities
completely
completely
shutting
shutting
down
down
with
with
only
only
essential
essential
workers,
workers,
including
including
work
work
and
and
school for
school for
students of
students
all
of all
ages.
ages.
However,
However,
there
there
is
is
not
not
enough
enough
research on
research on how
long the
long the
coronavirus can
coronavirus
live
can
on a
live on a
surface
surface
after
after
being
being
touched with
touched
someone
with
who
someone
is
who is
infected.
infected.
Therefore,
Therefore,
taking
taking
serious
serious
precautions like
precautions like
social
social
distancing,
distancing,
wearing a
wearing a
mask in
mask in
public when
public
leaving
when
the
leaving the
house for
house for
emergencies
emergencies
only,
only,
and
and
standing
standing
6 feet
6 feet
away from
away from
each other
each
in
other in
every
every
public
public
situation.
situation.
COVID-19 is
COVID-19 is
also
also
considered a
considered a
pandemic
pandemic
because of
because
how
of how
contagious the
contagious the
virus
virus
is
is
and how
and
many
how many
individuals it has
individuals it has
infected in a
infected in a
short
short
period of
period of
time.
time. Hello, this is Haley Gardner. On December 31st, 2019, an unknown illness was detected in Wuhan, China, and would soon be indicated as COVID-19 on February 11, 2020. COVID-19 was claimed to be a world pandemic by the World Health Organization and became a global crisis, demanding public places, including places of employment, education, and recreation, be temporarily shut down across the world, only allowing essential businesses to remain open. Most countries put temporary stay-at-home orders and instilled practices such as wearing masks and staying certain distances apart. Public policies varied between countries, and some countries have been slowly lifting regulations. Still, the world has faced higher rates of unemployment than ever before. According to the World Health Organization, as of May 14, 2020, there have been a staggering 4,347,953 confirmed cases of and 297,241 deaths caused by coronavirus disease worldwide. The Americas alone have reported 1,864,468 cases, which is the most confirmed cases, followed by Europe with 1,826,295 confirmed cases. Africa has the least confirmed cases. COVID-19 has affected societies worldwide, particularly people living in poverty, those who are immunocompromised, geriatric populations, disabled populations, children, and indigenous people. In response to necessary public shutdowns and stay-at-home orders, global unemployment, inequality, and discrimination have increased. Across the globe, populations of low socioeconomic status who have limited access to safe shelter, food, and water are most vulnerable to contracting and transmitting COVID-19, which is increasing the prevalence of poverty. For instance, the United Nations is predicting crisis within crisis for these populations, as 820 million people were already living in food insecurity worldwide before the pandemic. The pandemic is only heightening these issues. It has been difficult for world leaders to make decisions for their countries based on the difficult nature and unpredictable trajectory of COVID-19. It can be predicted that there will be long-term structural changes to all systems, though, as well as increased preparedness to human rights-based approaches to future possible global crises. As of May 15, 2020, there have been 1,412,121 confirmed cases of COVID-19 and 85,990 total deaths reported to the Centers for Disease Control and Prevention in the United States. Age groups 18 to 44 and 45 to 64 have been affected most. At each state's discretion, besides essential workplaces, businesses and workplaces, gathering and community events, faith-based gatherings, and park and recreational facilities were closed at the end of March 2020. Schools, colleges, and universities followed suit. Stay-at-home orders were put in place but were also at each state's discretion. Many states are considering reopening at the end of May or early June 2020, but most states cannot accurately predict when life will return to normal. State leaders are still grappling with this decision. According to the U.S. Bureau of Labor Statistics, the number of persons who usually work full-time has declined by 15 million, and the number of persons who usually work part-time has declined by 7.4 million over the month of April 2020 alone. As a result of unemployment, the majority of Americans have suffered financially. Economic impact payments have been issued by the Internal Revenue Service, which were created in April 2020 to act as financial relief for qualifying Americans across the country. In terms of mental health, the Kaiser Family Foundation have reported 45% of adults in the United States have reported their mental health to be negatively impacted over the pandemic. This is mainly due to isolation, financial distress, job loss, and anxiety over potential illness for themselves or loved ones.
Hi, my name is Catherine Mose, and I am an occupational therapy student at Bay Path University. I'm going to be speaking a little bit about the role of OT within a pandemic as it relates to mental health, in addition to the use of teletherapy as a service delivery model during the pandemic. So during COVID-19, the mental health of many individuals is being compromised, and during this time, there has been obviously, due to social distancing, there's been a decline in participation of meaningful activities, in addition to a lack of sensory stimuli and social engagement, as well as financial difficulties and a lack of adequate coping strategies that are causing individuals to experience a multitude of different symptoms, such as fear, anxiety, depression, boredom, anger, frustration, irritability, and stigmatization. I think that stigmatization is one of the more difficult ones, because a lot of my friends have had family who have had the virus, and I have seen how they have been treated in return. So I think that is important to consider, especially when we consider the role of an OT. So what can an OT do for someone's mental health during this time? I've collected kind of 5 of the most important things I think an OT can do for an individual during the pandemic in regards to mental health. So first I said was time management. So balancing time spent on listening to the news and social media with other activities unrelated to quarantine, such as reading or listening to music or learning a new language. We need to make sure that our patients and our clients are able to time manage during this time so they're not spending all of their time focusing on the negative. Another thing that we can work with them on is leisure exploration. So maybe we can influence creating and following a daily routine, making sure we're doing our work, we're getting 30 minutes of exercise, we're doing our learning, we're staying healthy, and just basically doing all the things that will keep our mind in a good space. Another thing OTs can do is advocacy, again, regarding the stigmatization, making sure that everyone knows that it doesn't define you or who you are, your family, if you've had the COVID-19, and I think that's very important. Another thing is influencing social engagements in a proper and safe way, such as assisting clients with resources and ways to stay in touch with their family and friends and loved ones during the pandemic to preserve their mental health, and especially the most important, coping strategies. In order for us to assist our clients, we can provide them with strategies that can relieve stress during especially such a difficult time. So I think as occupational therapists, our role regarding mental health right now is at an all-time high and can be very beneficial to our clients if delivered in the right way. Teletherapy as a service delivery model is very important during the pandemic. So what is telehealth? Telehealth is the application of evaluative, consultative, preventative, and therapeutic services delivered through telecommunication and information technologies. There's a number of different clients that telehealth services can benefit, ranging from young children in early intervention all the way up to the geriatric population. So, for example, telehealth services can be delivered in early intervention, school-based settings, pediatric private practice, and pediatric hospitals. However, also in the older clients, telehealth services are being delivered in regards to veterans, burn victims, adult private practice, mental health clients, and traumatic brain injuries. However, when you're considering whether teletherapy is an appropriate intervention choice for the client, you need to make sure to consider a lot of different things. For example, does my employer support me delivering teletherapy services? Will there be reimbursement? Do I have or am I able to acquire competency for safely and ethically providing services using telehealth technologies? Does my client have access to telehealth technologies, and if not, are they available in the community or can they be loaned to them? You also want to consider, does the licensure board in my home state and the state where the client is located have telehealth policies? And if so, how might these affect the delivery of OT services in telehealth? So you just really need to consider the standpoint of your client, if they have access to these services, if it is approved on your end through your employer, and if this is most suitable for your client and what their goals are.